Greetings, fellow traveler. As humanity awakens and evolves, we see change in every aspect of our lives. Let's consciously manifest our desires. I am Candace Craw-Goldman, and this is New Earth Journey. Greetings. Tonight is February 16th, 2016, and I'm going to do something just a wee bit different for tonight's show. As many regular listeners might already know, I'm very interested in health, and especially natural and alternative health. I'm always studying non-traditional therapies, non-invasive approaches, and my own quantum healing practice is, of course, a great part of my focus. So I'm going to talk a little bit tonight about my own health and take you directly and intimately into an actual alternative health session that I had just a few days ago in Georgetown, Texas, with an amazing healer and good friend named Brent Voth. I met Brent several years ago, initially when our son had pulled a hamstring muscle in sports. We were given a tip that if Dylan went to see Brent, he would fix him up right away and have him back in the game much sooner than if we went the traditional medical route. And we were not disappointed. Brent's practice is filled with athletes, even very famous professional athletes who come to see him from all over the world. But even regular people like me, people who've been in car accidents, or other types of trauma have happened to their bodies, or they have chronic pain, have been helped by him and the others in his practice. I'd been having some discomfort in my abdomen and chest area, and although my regular physician had been treating me and doing some tests, I decided to head down to Texas and get a tune-up from Brent because he always makes me feel better. So I recorded most of the manual visceral therapy session that was given to me just a few days ago. And the recording is both an interview with Brent and also kind of a play-by-play of what he's actually doing to assist and adjust my body. And by way of introduction, I'm going to read directly from his website at northstarmanualtherapy.com and then take you right into the recording of our session. So this is from the website. If you've been directed to our clinic or website by somebody who's received our manual therapy treatments, they may have used the endearing term witch doctors or voodoo doctors. Of course, this isn't the case. At Northstar Manual Therapy, we are licensed physical therapists who specialize in rare and extremely effective manual therapy techniques. The above-mentioned names have stuck over the years because we've achieved results that many patients never thought possible through physical therapy. Whether it's resolving chronic back pain that multiple other practitioners could not affect, or fixing a serious muscle strain or ankle sprain in few hours treatment, our results are extraordinary. And just as an aside here, I can tell you that I have been in the waiting room seeing somebody walk in with crutches, unable to put weight on a foot or leg, and then walk out with those crutches underneath their arms. I've seen that more than once. So back to the introduction. At Northstar, we believe physical therapy should be based on a whole body approach with every patient. We understand that compensations for a dysfunction in one area of the body can be the underlying cause of pain or injury somewhere else. In other words, the true cause of your pain may be in a completely different area than where you are experiencing pain. Once we have evaluated how the entire body moves and functions, we can identify the cause of a patient's symptoms. We can then create individualized treatment programs directed at correcting the cause of the symptoms, rather than just treat the symptoms themselves. Our manual therapy techniques focus primarily on soft tissue manipulation to realign the fascia and soft tissue distortions that occur with nearly every known musculoskeletal injury or syndrome. We are also highly trained in other areas of manual therapy like joint manipulation, craniosacral therapy, and visceral manipulation. And it's that visceral manipulation that I went to see Brent for. Unlike other physical therapy clinics, we do not use modalities such as e-stim and ultrasound, nor do we use physical therapy assistants or technicians to provide any patient care. At Northstar, our patients receive hour-long manual therapy treatments directly from their physical therapist. In most clinics, a PT or otherwise, getting you 20 or 30 minutes of one-on-one time with your therapist is a rarity. There is a rapidly growing amount of physical therapists and other healthcare practitioners learning and using manual therapy, but not all techniques are created equal. The application of knowledge and techniques and overall educational training can vary widely from one physical therapist or healthcare provider to the next. With this being the case, it is ever more important to seek out a physical therapist with valid credentials and a solid reputation. With over 28 years of combined experience, each physical therapist at Northstar is a highly qualified and credentialed practitioner. We also place a substantial emphasis on continual learning and improvement of our skills with extensive continuing education courses. The bottom line is we're passionate about getting results for our patients in the fewest possible visits. Our patients are not just a chart number at Northstar Manual. They're people with real stories, real results, and often become our close friends. And I can attest to that. It is quite common for patients to fly in from out of state and even out of the country. And then they say, go see the testimonials page. And that testimonials page is pretty amazing. So no matter what your story is, a painful condition or other health care provider has been unable to resolve, an athlete or have children who are athletes, can't afford to miss competition, or maybe your morning workouts and weekend golf rounds are becoming tougher, more painful, or you're simply proactive about your health, you're moving and functioning in your daily life, come experience the personalized care and rapid results of Northstar Manual Therapy.
Okay, so I've turned on the recorder, and I am just begun my manual therapy here at Northstar with a man who many consider to be a magician of sorts, Mr. Brent Voth. And I'm kind of going to do a play-by-play while I'm having this therapy done. So he has his hands on my abdomen right now, and he's listening to me. He's listening to my organs energetically. And he may tell us what he finds.
Yes, I'm listening through the organ system. It's called a visceral manipulation technique. So it's actually based on the mobility and the motility of the organ system and the fascial system that's surrounding it. So what we're identifying is any kind of restriction in that mobility and motility of the organs. So if, for instance, a kidney is locked down, it's going to affect the movement of the liver, the diaphragm, the cardiac system, the sphincters, which are the valves, and the digestive system. So it can really throw the entire body into a cycle of dysfunction and pain, restriction, and compensation, which will create new pain patterns.
So I've been coming to see Brent for several years now, and I tend to, for whatever reason, my body and my innards tend to get stuck. But as Brent has so happily said to me while I've laid here and he's adjusted me, my organs also tend to be very happy with this kind of therapy. They, for whatever reason, they sort of get into a position and they don't move as much as they're supposed to. I'm also a person who develops scar tissue. I've always wondered if that physical or chemical composition is part of why they get sticky inside.
Right, yep. And a lot of times when you do form scar tissue or adhesions, it obviously affects the visceral system because it it restricts that mobility and motility. So a lot of times I'll see with any type of abdominal surgery, whether it's an appendectomy or gallbladder, any kind of introduction of air into the abdominal cavity is going to create a lot of restriction, adhesions in the organ system. Even like any kind of endometriosis or cysts on ovaries, things like that, tend to tell me that the organ system will be a little more restricted.
Wow, is that with C-sections too?
C-sections.
Yeah.
Anything that introduces, air into that abdominal cavity, you lose that serous membrane, that wet membrane where these organs can move. Because everything in our body is alive, right? So everything has to have movement. And we tend to forget about our organ systems that are alive and moving. So as you bend and twist and move, they have to be able to slide and glide. And at rest, they still have circulating blood and tissues, or circulating blood and lymph going through them, so they need to be able to move, even at rest.
Well, I've not ever had abdominal surgery, so I can't blame any air in there, at least that way. So while we're sitting here chatting, he's got his palm on my abdomen and on my side and back now, and he's just gently releasing the organs from where he's feeling them be constricted or stuck. And it's very interesting. Over the years, as he's doing this, I will tell him where I feel it. So like he's kind of concentrating on my right side below my ribs right now and my right kidney, and yet where I'm feeling it, Brent, is my left armpit.
That shows you how much the organ system affects the body. Like, again, for instance, a car accident, when you're, seatbelted in, that stopping of the car and the seatbelt stopping the body doesn't necessarily stop the organ systems. So the organs will continue forward until a suspensory ligament or a rib or, the abdominal cavity actually stops that motion. So that's why a lot of people suffer so many symptoms after the car accident, even though they look physically fine. The MRIs, X-rays show there's no, destruction of the bony tissues or even the soft tissue injuries, which the soft tissue damage they see on an MRI. It's more of what the organs are doing or not doing as far as mobility.
Well, I was in for a session yesterday, and the reason I'm here is because I've been just having, I haven't been feeling well. I've been sort of lethargic. My energy level's been off, but I've been uncomfortable in my abdomen, and including to the point of there have been some times over the last weeks and months where I literally haven't been able to even eat. Not eat at all. And what Brent has found is that I actually have something called a hiatal hernia, which is a hole in my diaphragm where my stomach tends to migrate up and sit in there. And that's been giving me a lot of problems with eating. But after leaving here yesterday, I went straight to Taco Deli on Burnett Road. Had me some scallop tacos with Dylan and some queso, and was a very happy girl. And then after that I went hiking for an hour, and I just felt so good. And I'm back today to kind of keep this going, keep my stuff moving around. And I'm not waiting so long before coming back. I waited a year before coming back. Flew all the way down to Austin to do this, and worth every penny of the expense it took to get here to feel.
And that's the trick with visceral manipulation, is it's actually, I'm not restarting or I'm not moving the organs, I'm just restarting the body, because the body's natural tendency is to have movement. So I'm just kind of assisting the body, telling the body it's okay to move again, and just generally bring it back to its natural embryonic motion. So as we develop, from the embryo into an adult form, our organs kind of unfold almost like a flower. So there's a rhythm where that visceral motion is actually in the direction of the embryonic development.
Beautiful. Brent and I have had hours and hours and hours of conversations about health and healing over the years, and he's very much versed and educated about the mechanical system and function and structure of the body, but this man is a healer. He's like a shaman and kind of doesn't know it in a way. He closes his eyes and there is no body like this fella out there, although we do have in the room today a young woman named Milena who is shadowing Brent, and hopefully we'll learn some of his magic and his gift, because it's truly a gift what Brent's been able to do. As a matter of fact, our family met Brent back in, and I think it was, 2004 or 5, something like that. Maybe, I don't know, somewhere along those lines.
2001. Was it in Maynard?
Well, no, it was here.
No,
it was
okay,
Dillon, and we got here in 2002, so it had to have been after that, but maybe it was just 2003 or so, but our son was in school, in middle school, high school, and it was a hamstring injury. And we got a lead from a friend of my husband who said, you take him right away over to see Brent. So we took our young son to see Brent for a hamstring injury, and I'm still not sure what they do conventionally with hamstring injuries, but Brent does his thing and does some manipulation and puts ice on it, and then says things like, you're going to be fine and be able to play, in a day or two or whatever it was that you said, which was so completely opposite of what the traditional conventional medical wisdom is. And I've been in your office, Brent, where I've watched athletes come in on crutches, and I'm waiting for my appointment, and I watch them walk out with their crutches under their arms.
Right, carrying the crutches.
Yeah.
In the soft tissue side of it, what I typically see in sporting events was hamstring pulls, muscle strains, ligament sprains. Those types of injuries tend to be a fascial dominant injury, meaning the fascia is the connective tissue. It's what supports the body. It's what gives us tone in our muscles. It's what supports the muscle systems. It's intertwined in the muscles, in the organs, in the ligaments. So it's actually treating the connective tissue versus treating the symptoms of the sprain. I'm not so much worried about the swelling. I'm not so much worried about the bruising. I'm more worried about the dysfunction of the actual connective tissue. So we can actually get into that connective tissue fairly quickly and instantly fix the dysfunction there, which then relieves the symptoms so that are pain-free and able to get back to their activities much quicker.
It's so amazing to think about that. So the fascia is, if you're not completely sure what that is, if you're in the kitchen at all and you're cooking like chicken or whatever, it's that thin white membrane that goes over the muscle. And we all have that around our muscles. And that's what Brent's talking about. He kind of deals with that. And so the conventional wisdom just leaves that fascia. They just ignore it. Right, and then it just stays injured and gets stuck?
Yeah, the problem with fascia is it's primarily avascular, meaning it has very little blood supply, so it doesn't heal. It leads to scar tissue, so that's where the adhesions come in. So think of a piece of saran wrap covering our muscle. And if you put enough force on saran wrap, it's going to fail. And then when it fails, it wrinkles up and kind of gets twisted together. Same thing with that fascia. It doesn't have an ability really to heal itself. It just comes in with scar tissue. And then you start having adhesions and restrictions, and which inhibit the muscle, and therefore you have pain because the muscle is no longer firing like it should, so there's weakness, instability, pain. And again, if you can fix that fascia and realign those cross-links together of the fascia, it's almost instantaneous relief and strength, and range of motion improves.
So since you've been doing this, since I've even known you, 12, 15 years or whatever, is anybody else catching on to this, or are you still a lone wolf out there?
Well, for the most part, I'm a lone wolf, but you hear a lot more people talking about fascia. There's more and more manual therapists addressing fascia. There's different forms of treating fascia with, let's say, ART, which is active release technique, and some Graston tools where they actually use scrapers to kind of smooth out the tissue with tools. But as far as the things we're doing, as far as I know, I'm the only one, or we're the only one here at Northstar that can get the results we do as quickly as we can. And we're working with professional athletes and weekend warriors, and for even down to an infant stage, we're able to help infants with
Wow.
colic and
Wow.
sleeping and eating, and just the techniques we use. So it's not one technique; it's multiple techniques we have in our toolbox that we're able to treat a multitude of things.
So, if you wouldn't mind, when I first walked in today's appointment and into yesterday's appointment, and I think you do this with everyone, you do this thing where you have people stand there and you put your hand on their head and you say you listen to them. Would you describe what it is that you're doing?
Yeah,
there?
that's a listening technique. It's actually through the visceral system. So the body will speak if you are sensitive enough with your hand and you allow it to speak to you. So there's a general listening technique and a local listening technique. So the general listening technique is done in a standing platform, and basically I place my hand on your head, and instantaneously you can sense where the pull of the body's coming from. So let's say you have a right knee restriction. As I put my hand on your head, I'm going to feel a drag down to the right side of your body to the lower half of your body. So it gives me an idea of where your main problem is. Your symptom may be in your left shoulder, but the listening is telling me it's a right knee problem, right?
Yeah, because it's all connected.
It's all connected. And then from there you can go into local listening, so you can kind of narrow it down. You usually supine on your back, lying on your back on the table. You can actually listen individually to the body and really hone into that area of dysfunction. Again, it's due to the draw of the tissues being twisted and restricted.
And I bet you've gotten more sensitive over the years.
Absolutely. It's, with treatment and practice, you just hone your skills and improve, and that's where the experience is hard to replay. You can't teach experience.
So people come, I was going to say all over the country. I bet they come from all over the world to see you.
They will fly. I mean, I've had them flying from Australia.
Yeah.
My last patient flew in from D.C.
Yep.
I'll travel to work with professional athletes that are out in the field. So.
Yeah, because as important as health is to everybody, it's the professional athletes who really love Brent, and his waiting room shows that with all the pictures. I took some pictures of your pictures.
Yeah, you did.
To prove it.
They get paid to perform, so if they're
Right.
not performing at an optimal level, it affects their occupation. So, and just in general, people. I mean, if you have the opportunity to feel better and you don't take advantage of feeling better, I always say to me it's about prioritizing what is good health worth to you.
So I'm really interested, kind of in your background and how you came to be, who you are, helping so many people in this way, because what you're doing is called, manual therapy. It's something beyond physical therapy, but you train in some of those traditional ways, but yet you just kind of veered off into this place. And I wonder, can you tell, the listeners of the radio show, how did you get to where you're listening and looking at, you're outside the box. So how did that happen for you?
Well, I went through traditional physical therapy school, so I'm actually a licensed physical therapist. And I got into that field just due to personal injury through high school playing football, and I was in a farm accident. So that brought me to the physical therapy field. And I enjoyed what the therapists were doing and how they were helping me, and I was making improvements. So that's what got me into the field initially. And once I got through PT school, I was doing traditional physical therapy, which was more exercise-based, more stretching-based. It was insurance-driven, which is the part that kind of turned me off to traditional therapy. I was seeing 4 and 5 people an hour, and I felt like I wasn't able to make significant progress in that time, so I didn't have enough time to spend with the patient. So from there, I started looking at alternative methods. I got outside the orthopedic box. We were just treating symptoms versus actually identifying problems. So we'd get people feeling better temporarily. They'd come back and say, well, it was better for, an hour, and then it came back. So that kind of led me to hone my skills and find alternative ways to treat. So then I got into craniosacral therapy and visceral manipulation and different techniques, which were all hands-on approaches.
Yeah, it's this visceral thing that you're doing to me right now that, I made a cursory exploration of trying to find somebody to do this up where I'm living currently in Kansas, and just, basically didn't, decided to call American Airlines instead. Well, come on back down to Austin to see you, or actually Georgetown's where we are.
Right.
But it's just, it's shocking to me. The day that I had yesterday and feeling so good and hiking around, and I'm thinking about all of the people on the planet who may be in a similar situation that I was in, which is basically just not feeling well and having some digestive and pain issues, very strange, and moving around different things, and how many people will go to conventional doctors and, they won't even come close to doing what you're doing to me right now, which is, going to the direct source of the problem and helping there. And it kind of breaks my heart, and it's one of the reasons that I've got the recorder going during this treatment, just to kind of share this information out there. And also, I know there's a lot of people who say that what Brent does is ouchy, and sometimes with the hamstrings and some of the other things.
Right.
I know he gets that, but I always feel wonderful, and I can talk through everything that Brent does.
Yeah. There's different depths of treatment, right? Visceral manipulation is very light. Craniosacral therapy is very light. But if you're addressing the connective tissue, the fascia, you need to apply as much force in fixing it as it took you to hurt it.
Wow, now that's an interesting statement.
So yes, that's where you really have to get deep enough to fix that connective tissue.
And that's where Brent's thumbs
I have a lot of nicknames for the thumbs.
I bet you do.
But another one of the advantages to what I'm doing is the time I have with patients. I have a full hour of one-on-one time.
And that's because you don't do insurance at all.
Right, it's a cash practice, so I can actually focus on quality versus quantity, right? So I can do good work versus...
And that's a big thing to talk about in any profession. It's the same the reason, the dentist that I was going to here in Austin also, no insurance, all self-pay, because they just go to the problem, they solve it the way they professionally see you need to have your problem solved, not by some bureaucrat somewhere pushing a pen, limiting your time and limiting your options to help people. So for those people out there who want health care for everybody, I understand where that comes from, the desire for everyone to have good health. But when it's insurance-based and system-based like that, program-based, you're just not going to get the quality.
Right, and when we did insurance-based, you're basically worried more about tests and progress rather than people getting well. So I was doing more testing and documenting and measuring of joint range of motion versus actually treating.
Sounds a little bit like school systems, teaching to the test.
To the test, right? Because that's the only way you get reimbursed. You have to show progress or they stop paying. So in this situation, I'm focused purely on the patient. I'm about getting them well.
And you have no problems filling up your books with appointments.
No, I was going to say, if you ever want to look for a good practitioner and look into the private pay sector, and if you can find somebody that doesn't take insurance and that is very busy without advertising, they're doing something right.
Yeah, and that's you.
And it's word of mouth. Advertising is what I rely on. I don't spend money on advertising because the work speaks for itself.
You don't have to. You just don't have to at all. So it's been a little more than a year since I was here doing this. I was here in March of 2015 last time, and interestingly enough, the gal in the exam room right now, Melena, was here shadowing at that time. And what Brent did was basically some of the same stuff, unsticking my kidneys. And I was telling both of them, not more than a couple weeks after that, I literally ended up in the ER passing a kidney stone. And I fully believe that I was there and that was happening because of Brent's treatment and the movement. And it was a good thing because, I didn't have to do lithotripsy. I didn't have to do, some really awful things to deal with a kidney stone. I truly believe that, Brent asked my kidneys to begin functioning again in the correct way, and one of the things that they did was begin releasing those impurities that don't need to be in there. And he found that my gallbladder is very stuck, and my stomach was up in that diaphragm, and that was actually keeping me from eating.
Yeah, many times what I find with a gallbladder that's non-functioning is literally due to the amount of bile that's stuck in the gallbladder. So there's a technique we use that actually will flush the gallbladder. It's called milking. You can actually milk the bile out of the gallbladder down into the...
and that's what you're doing a little bit of that yesterday and even today, which is...
Right. And as you open the valves, a lot of times that the gallbladder stuck is because of the valve that it drains into is stuck. So we'll release the valve below it, which will then allow that bile to come down through the duct and flush that gallbladder. So that's a very common surgery is removal of the gallbladder.
Yeah. And you just don't want to have to remove any organs if you don't have to.
Yeah, I mean we're those organs are put in our body. The good Lord, probably knew what he was doing.
Yeah. Yes, agreed. And in all of those ways, the appendix, and then of course, look at all of the women who, you don't need that uterus and those ovaries anymore. Well, I beg to differ.
Yes.
If you can keep any of that structure in your body, you probably ought to.
If you can keep all your organs just for hormonal reasons and various, support reasons, you want to try to keep all your parts.
It's interesting to watch Brent work because he kind of closes his eyes, and I think he just kind of goes into the body, and he places his consciousness there, and it's magnificent. I was talking to him yesterday. He didn't really answer when I said this, but I said, Brent, I bet you do this already. Not even with your clients right in front of you, but I bet you do it in the dream state, or even when thinking about somebody coming to an appointment, or in the in the shower while you're thinking about your work day ahead or whatever. And I'm a firm believer that some of this work that's happening right here now on the table is just so incredibly beneficial. But I'm a firm believer that our consciousnesses, both Brent's and mine, at some point, met up in the ethers and already began this connection and this therapy long before, maybe I even got on a plane to get here. Because I see that happening in my own work and my QHHT work, which is the hypnotherapy, primarily the past life regression kind of work. Time and time again, it is proven to me that our conscious minds kind of are along for the ride. Often we think that everything is happening in our conscious mind, but I think things are happening in a bigger way, in a bigger stage, in another way. And our conscious minds are able to see the results. They're able to measure. They're able to see things linearly. But our conscious minds often can't solve the problem. We need to access a bigger part of ourselves to do that, or particularly the right side of our brain, the part of our lower consciousness that has a direct communication to those higher realms. And I'm a firm believer even that the simple act of closing your eyes, which is what Brent's doing right now as he's circling around on my abdomen and following the paths of movement and etc. I think there's a heck of a lot more going on here than just hands on a body moving organs through tissue. And I say that a lot for you, Brent, over there, Milena, because, what Brent's doing right now is connecting on a much bigger, deeper level. And as he said earlier, it really can't be taught. You can watch, but it's getting yourself into this and beginning to try to help people in this way with an open heart and a pure intention to help people be the best and healthiest that they can be.
you access some of these other levels, which again, going back to the very mundane but the very important insurance and traditional modes and stuff. You know what? I think if you do this for money or fame or status or glory, I think some of that connection gets cut off. Mm-hmm. And I think that's what's so amazing about this guy right here is how he just keeps doing what he's doing just himself. And I know he's had a lot of people come in and kind of watch, and he's kind of trying to share his gifts in a teaching way like that. But this is magic for the real world. Thanks so much for letting me record you while you're doing all of this, Brent.
Absolutely. I think if the word gets out there, more people will realize that there's other forms of treatment out there than just traditional pharmaceutical worlds, mm-hmm. which there's a place for all the traditional
sure.
stuff, but it definitely gets overused, and I think medication gets overprescribed.
Yep.
And if there's a way to fix people with hands-on work, even through massage, any kind of body work is beneficial to the body. Hands-on body touching,
mm-hmm.
skin to skin is very therapeutic. It's very healing.
Even hugs.
Mm-hmm.
People who don't get hugged on a daily basis are in general less healthy.
Mm-hmm.
And look what we do to, on the really awful side of humanity and culture, but look at what the worst thing is that we can do to people who are trying to punish. We put them in solitary confinement
mm-hmm.
in prison systems, and that's because that's no contact at all.
Mm-hmm.
And no physical contact is one layer of but no interpersonal contact at all. We as humans just need this.
Mm-hmm. Absolutely.
We need this connection and massage and etc. And even some self-massage can be helpful. But I think when you combine energy fields of a practitioner and a client, there's a nicer thing that happens there. And I guess that's kind of why I'm doing this too. Here comes the woo-woo if you're ready. So what you're doing right now, what are you doing? You're pushing, what is mostly pushing right there?
This is kidney. I'm working on her right kidney,
yeah.
which tends to have issues just based on the weight of the liver,
mm-hmm.
Which sits above it. So the right kidney tends to get stuck more frequently than other organs.
And totally, again, in my left armpit.
Mm-hmm.
My left armpit is ouchy. But I believe... because it's been proven to me that simply even broadcasting this, which I'll do on my show coming up here in a few days via recording, I think that people out there will benefit through time and space from these ideas and even this healing that is being offered just to this particular human body. There's another, which is mine right now. Thank you, everybody out there. But there's this phrase in one of the healing modalities that I say that really strikes me. But I think it's very, very pertinent, and that is, my healing blesses all of creation. I think that's so poignant.
Mm-hmm.
I think because we really are all connected. Far more than we believe.
Mm-hmm.
You know how bees are connected or flocks of birds are connected. We as humans are far more connected than we know. So anytime there's healing for any human, which gets very woo-woo if you think about it, but I really believe it's true. I believe on some level, somewhere, a healing on me and, on somebody all the way across the world in China, somewhere that somebody's doing something similar, is helping all of us. And even this little radio show, I think just listening to it and having your mind open to the possibilities and listening to our voices while healing is happening on some level is going to help even you, the listener. I really believe that.
Well, it's funny you go to that point. I'll from time to time, I will actually, in the evening when I go home, I'll actually feel some of the symptoms that my patients came in with that day.
Yeah.
I'll have random pains in my ankle or my knee. I'm like, I treated that today in therapy. I'm absorbing or taking over some of the...
Okay, so here, what are you doing about that?
I actually go into a subconscious state, I believe, and allow it to clear.
Yeah, watch it go away.
Reset it. Mm-hmm.
Yeah, if you have, there's many, because I'm the same way. When I have my own clients come in who are either depressed or have, you have to, as a practitioner, be very cognizant about some of that, and there are many ways to release that. There's visualizations, there's other things. Even simple things like, for instance, I don't know what you do in this room, but this room is a combination of two things. It's a place where miracles and healing happens, which is amazing, and that's absorbed into these ceiling tiles and into these walls. But there's also some of the pain and the ouchie that's absorbed into here. So there's different things that you can even do to clear this place. Some bells. Sharp bells, and I know you probably wouldn't do it, but a little bit of sage smoke, or there are just some different ways of simple visualization, the idea of a big clearing white light, and that doesn't remove any of the miraculous things, but it helps some of the darker things go out. And these sorts of things, I truly believe, make for even a more spectacular healing experience, which is why people walk into my wellness studio up in Kansas, and sometimes, very oftentimes, they'll say, "Oh, it feels so good in here," and that's because you may not be able to know it, but it's because I do those kinds of things. I encourage keeping the high vibration of the health, the miracles that happen, the answers, the peace, the balance that shows up. And at the same time, releasing some of the lower energies, which are, fear or pain or confusion, etc. So what do you think of all of this talk, Malene?
Which part of it?
Our student that's in the room.
Yeah, I was just wondering, I live in this world, this woo-woo world, and I think about Brent as... Brent's mostly I think we have good conversations. I don't think he thinks himself as too very woo-woo, but on the edge of woo-woo, shall we say.
I would say that's probably true.
You're on the edge of woo-woo, and so, and Milena is young and coming up in the world in a different age group, but I just wonder, how weird is all the things that I'm talking about today to you? Anything?
Not really. No, I fully believe in it. We talked about this the last time I saw you, because my dad is actually in the remission, yeah, of cancer.
Yeah.
Colon cancer.
And I fully believe that a lot of what he went through was very much mental and based on him and what he wanted out of it, more than what the treatments were giving him.
Yeah. That's something else that I've been talking about a lot lately, which is this idea that a lot of people will say, "Oh, I had this disease or that one or cancer, and I went through this treatment and it cured me." Well, it's not like I discount, or anyone should discount, improvements or cures or remissions, but sometimes maybe it was the quitting the job to get the treatment, or laying there and being grateful for your family that you thought about before having your operation. That was the real, fuel or drive to get you better or well. And you walk out of there with you and the doctor and everyone saying, see that procedure, that treatment, that thing, that whatever is the thing that cured you, but maybe it was really a large measure some of these other things, and you're right, Malene, some of the emotional, spiritual things going on. And of course, the irony of that is I always wonder, so where am I stuck inside? Right? Why am I stuck inside a lot? I ask myself this. I do my best to think about it. I think we set ourselves up for challenges, but yeah, there's a lot of different ways to think about health and healing and how to achieve that. Well, you know what? Thank you so much for this. I'm gonna turn the recording off here in a second, but I'll
I'll ask you, Brent, if you have any final words for anybody out there who might be interested in helping athletes or people in this way, and kind of a different approach to helping people on their physical level past massage or regular physical therapy. What advice would you give? I mean, I guess it's the same kind of advice you give to Melaine.
It's just having an open mind, search all aspects and avenues of healthcare, even from acupuncture and energy work and there's more to it than just a traditional approach. So to go into it with an open mind, with a healing mind, and find that practitioner that's there for you. Like you said, it's not about the money, it's not about the fame, it's about helping people, and if they can't help you, they should be able to lead you in a path to where you can find help. And I'll refer a lot of my people on. If I'm not able to help them, I'll try to figure out what that.
I can't even believe that. Who in the world can't you help?
Yeah, there are those out there, and a lot of that has to do with more of the physio or the chemical part of it. Their hormonal levels, or they're lacking some they're deficient in some form of vitamin, or some kind of supplementation is needed.
Well, even so, I stand by my statement. I can't imagine that really anyone couldn't be helped by your cranial sacral work, your manual therapy, because I've been helped by you so very much over the years, and so has my entire family. So we've come to the end of the therapy session today, and it's been amazing. I already feel better.
Thank you so much,
You're
Brent.
very welcome. Thanks.
All right.
Brent earned his master's degree in physical therapy in 1995 from the College of St. Scholastica in Duluth, Minnesota, doing his thesis work in manual therapy. Wanting to gain as much knowledge as possible out of college, he began his career as a traveling therapist, contracting around the country with different health organizations. Discovering his true passion was hands-on manual therapy, Brent came to Austin, Texas in 1999 to focus solely on this type of specialized work. Brent proudly opened the private practice, Northstar Manual Therapy, in 2004. He has been recognized in various newspapers and by different organizations for his experience with manual therapy, including his success with treating all types of acute injuries, visceral problems, and cranial ailments. To expand and broaden his specialty in manual therapy, Brent pursues intense continuing education classes around the country each year, and in his spare time, Brent enjoys all sports, anything outdoors, and spending time with his wife, Lana, and sons, Gavin and Connor. Thanks again, Brent. I feel wonderful. Thank you so much for tuning in to listen to the story this evening. And come back a couple weeks from now where we'll have another interesting show for you. So thank you again. Good night, and all shall be well.